Good afternoon to all of you. Welcome to our 18th anniversary of the Amuma Cancer Support Group Foundation Incorporated. I am Jocelyn V. Inano, your host for today's webinar on cancer awareness. This is the flow of our program. Invocation, then followed by the Philippine National Anthem, welcome remarks, introduction of a speaker. There will be questions and answers. After the talk of our speaker, please prepare your questions and type it at the chat box or comment box, and our facilitator will entertain you later. Then there will be an announcement, closing remarks, and closing prayer. And that will be the end of our program. So, to formally start the program, let us pause for a while for the invocation to be followed by the national anthem.
Our ever-loving Father, the core of every reason, the source of truth. You who made the earth and the heavens are the ultimate goal of every knowledge seekers, the infinite wisdom, the cause of all that is good. We are truly grateful for this opportunity to gather together as a community despite the challenges we face each day. Yet you remained and gave us strength to carry on the responsibilities of bearing intelligence and using them for better purposes. We now humbly ask you to join us in our endeavor to explore the wonders of life in the world for knowledge's sake, that in whatever we learn today, we become more grounded to you, who is truth, who is love. We pray that you bless our speakers, the fount of your infinite knowledge, that they can share something worthwhile despite the limited time we have. They can channel all they know and share to us the beauty and truth of living as your child. We pray that you guide our participants, the seekers of your boundless knowledge, that they may continue to persevere in the search and be deemed worthy to share what they learn from today's session. Sanctify us, O Lord, not because we are worthy of it, but because we believe in your love and mercy, that at the end of the day, we can take home something that's amazing and meaningful. This we ask and pray through Christ our Lord.
Mm.
Father, Son, Holy Spirit. Amen. Ano?
Mga kababayan, ang pambansang awit ng Pilipinas.
upang hiram, duyan ka ng makiting sa manluluto. Di ka pasisiil at bundok sa simoy at sa langit mong buhang. May dilag ang tula at awit ng pag-asang
Hello, world. I believe, if I'm not mistaken, some of our participants are coming from different countries. How amazing that Amuma is getting international. I'm pretty sure that we are all excited because for the first time, the Amuma Cancer Support Group Foundation Incorporated is celebrating the 18th anniversary that will be aired online. To start with, may I call on our gorgeous and energetic president of the Amuma, no other than Miss Cherilyn Kasuga for the opening remarks.
Hello there. Hello world talaga. Thank you, Miss Joy. Thank you, Ate Joy, for your very energetic. Thank you for that. You are so energetic. So, for my dear Amuma board members, directors, to our speaker, Doc Carol, and of course to our this is pure energetic Doc Gina, the chairperson of education committee. I salute
View
you.
options ako, anak. Ay, sorry.
Thank you. Good afternoon, everyone. I am welcome you all in our first webinar series under the education committee, entitled Recommendations for the new update for gynecologic cancer screenings. No, as some of you may know, I am also a cervical cancer survivor stage 2B. No, so this is special or personal to me. And also, our speaker is also been one of my OB oncologists. So I hope that all of you will be able to learn about this afternoon's webinar. And for those that not known yet about Amuma, Amuma is celebrating this month our 18th year, no? Debut na po. So this is the long-standing cancer support group foundation ever established here in Davao, or even in the country. No, medyo matagal na rin siya. So basically, just to give you a background about who are we. So we're basically a group of passionate individuals, dynamic and caring, no, committed to serve, committed to meet the spiritual, emotional, and practical needs of our cancer patients, families, and caregivers. So you see, we really include the caregivers. And how do we do that? We provide holistic care and support through building and maintaining a healing community for education, counseling, networking, and empowerment. So up to this moment, we still stick to our advocacies, and that would be cancer awareness, prevention, and control. So I'd like also to let you, I hope that you see these familiar faces, no, very responsible, presenting to you our 2020 for Amuma officers. So our Vice President, Mr. Romeo Reyes, and then our Corporate Secretary, Cheryl Otohan, our Corporate Treasurer, Grace Adaw, and our Auditor, Ms. Christy Cancio, and our public relations officer is Agnes Luna. I have mentioned earlier about those practical networking, spiritual education. So basically, our functions revolve into these five committees. So first, and this is the education, and this is being chaired by Dr. Gina Alvarez, and of course, vice chair by our MC, Jocelyn Enano, and then our spiritual, our chairperson is Miss May Hipolito, and vice chairperson is Miss Bella Sarenas. She's also a board, and she's been one of those pioneers who established also our Amuma. And then our psychological emotional counseling is being chaired by Maria Fe Magallanes and Vice Chair Rose Sonora. And then our practical networking is being chaired by yours truly. And then I have my Vice Chair, which is Rachel Ubungan. And our membership information and communication is being shared by our Vice President, no, Romeo Reyes, and our Vice Chair for this committee is Miss Agnes Luna. So these are the working group committees that's really, we really work hard to make this our organization, our community, to be able to reach out to more of cancer patients, caregivers, families, and friends, no? So I hope that you'll be able to join us and become a member, be one of us. And if you would like also to support our advocacies or love offerings, our bank accounts being posted there, and some payment platforms. So if there's anything that you would like to know for suggestions or questions, again, you may contact me, and that is my contact number there, and then our email address, and also our Facebook. Please like our Facebook page and also our YouTube. So that's it. So thank you so much for the time, for the listening, and I hope that this afternoon, Friday afternoon, evening na pala, will really be more, you'll be able to learn more about your body, especially for the women. And for those not mga males natin, please be sensitive, and hopefully your mothers, your sisters, your wives, your, I don't know, your girlfriends, you may want to share these information. So again, thank you so much. Thank you for being here with us virtually. This is not the first. Definitely. Okay, we will be able. So I first pala, I would like to apologize for the technical. We don't have a technical team, no? It's only us. So please bear with us. So thank you so much. So now I'll give the virtual floor to our MC, Miss Joy. Thank you po.
Thank you very much, Madam President, for that inspiring message. At this juncture, may I call on the former president of the Amuma, an obstetrician and gynecologist, Dr. Gina Alvarez, who will introduce to us our guest speaker. Take it away.
Okay, thank you, Joy, for that introduction. Tonight about, or this afternoon, we are very um, privileged. We are very happy because we would like to share with you uh, our speaker for this afternoon. She's our distinguished speaker for this afternoon, no? And so she is a graduate of the University of the Philippines, Philippine General Hospital, where she had her residency program in obstetrics and gynecology, as well as her fellowship in the section of gynecologic oncology in the same institution. She's a local. She is really from Davao City, and she is the present chair of the Davao Doctors Hospital Department of OBGYN, Obstetrics and Gynecology. And she's also a consultant at Southern Philippines Medical Center, as well as of Davao Regional Medical Center in Tagum. So she is a oncologist also in the different hospitals. And we are very lucky because she is here to share with us her expertise on the current recommendations on gynecologic cancer screening. So, friends and fellow members of the Amuma, help me welcome our speaker for this afternoon, Dr. Carol Marjorie Pacholes Flavier. So, Nat, the virtual floor is yours. Thank you very much.
Yes, good afternoon to everyone. First of all, I'd like to congratulate the Amuma Cancer Support Group Foundation for your 18th anniversary. So congratulations for that. And thank you also for the invitation. Thank you, Doc Gina. And hi, Che. I'm glad that you're doing well. And I see some familiar faces, si Tita Bella. She's the mother of my high school classmate. And si Tito Ding Palafox. She saw me growing up. Okay, so without further ado, I'll share my slides. Oh, but can you enable me to share my screen?
There, Doc. Sorry.
Okay, thank you. So for this afternoon, my topic will be about the current recommendations on gynecologic screening. So actually for the newest recommendation would be for cervical cancer, just this 2021. And the others for endometrial and ovarian cancer, there are no new screening recommendations. And for breast cancer screening, we will be using 2018 recommendation. Okay. So what is screening first? So screening is a form of secondary prevention. It is a means of detecting disease early in asymptomatic people. So the operative word here is asymptomatic, meaning you don't have any symptoms and you just want to check whatever it is that you have. So this is what we call screening. So it will detect a pre-cancerous condition, pre-malignant condition, or probably an early stage disease. Okay. So when you do screening, the positive results it's usually not diagnostic. It will not say that you really have that cancer, but it can identify people with increased risk for the presence of cancer. And if this screening tool is positive, it would warrant further evaluation. So for based on the 2015 Philippine Cancer Facts and Estimates, here are the leading cancer sites in females. So number one pa rin ang breast cancer. And then the number two is cervical cancer. This is different from cancers in females in the world because they have a low ranking for cervical cancer. Unfortunately, in the Philippines, it's number two. Then we have the ovarian cancer, top 5, and for the uterine cancer, it's top 8. So those are the highlighted female cancers that I will be discussing later on. Okay, so let's start with breast cancer screening. You're all very familiar with this ribbon. No, this is the symbol for breast cancer patients, survivors, etc. Okay, so for an overview, breast cancer is cancer arising in the breast tissue. It's primarily a disease of women, but 1% of breast cancers can occur in men. Okay, for a woman, her lifetime risk of developing invasive breast cancer is about 1 in 8 women, or around 13%. So gender is the biggest risk factor because, as I said earlier, breast cancer occurs mostly in women. It may occur at any age, though the risk of breast cancer increases with age. So the older you get, the higher your risk of getting breast cancer. What are the possible causes of breast cancer? So a possible cause is that A woman with a personal history of cancer in one breast has a 3 to 4 fold greater risk of developing a new cancer in the other breast. So this new cancer is not a recurrence. No? If you are familiar with the term recurrence, meaning bumalik yung cancer mo, no. This is a term, the 3 to 4 fold increase is a new cancer developing. Okay. And more importantly, there's a genetic cause for breast cancer. So family history has long been known to be a risk factor for breast cancer. And then the risk is highest if your affected relative develop breast cancer at a young age. What do you mean by young? Mostly we peg it at 40 years old or younger. If your relative also had cancer in both breasts, and if she is a first degree relative, so a first degree is a mother, a sister, or a child. Rather than father, kasi breast cancer can occur in males too. So those are considered as your first degree relative. Okay. Hormonal causes can also be a risk factor for breast cancer. So women who start periods at an early age or experience late menopause have a slightly higher risk of developing breast cancer. But having a child before age 30 may provide some protection, and having no children may increase the risk for developing breast cancer. What about your lifestyle and dietary causes? So they occur more frequently in those women with high dietary fat intake. So being overweight or obese is a known risk factor for breast cancer, especially if you're already postmenopausal. And also the use of alcohol is an established risk factor for development of breast cancer. But then again, if you're just a social drinker, that's fine. These are those who are chronic alcoholic beverage drinkers. And studies also show that regular exercise may reduce a woman's risk of developing breast cancer. So actually, it's just healthy lifestyle, no? We good diet, exercise, ayun. So these are parang universal causes of the different cancers. Okay. What about our breast cancer symptoms? So early breast cancer has no symptoms. It is usually not painful. And it's usually discovered before you have symptoms, no? By finding abnormality on your mammogram or feeling a breast lump. So usually asymptomatic ang early breast cancer. Okay. What do you check for? A lump in the armpit or above the collarbone that does not go away may be a sign of cancer. And some other symptoms are breast discharge, nipple inversion, or changes in the skin overlying the breast. So if you see your skin na parang orange peel, yan siya, parang it's already a symptom of breast cancer. So the meat of my lecture for this breast cancer is based on two societies. So it's the American Society of Breast Surgeon and the American College of Radiology. So the Philippines follow the recommendations of these two societies. Okay, so what are their recommendations? Women age 25 should undergo a formal risk assessment for breast cancer. So what's a formal risk assessment? Actually, there's a form in the internet, but what we usually ask our patients is just a family history of breast cancer. So medyo if you find na medyo chismosa ang gynecologist mo, it's really part of the risk assessment, no? So they ask you if you have relatives with breast cancer, or meron ka bang lump before na hindi mo pina-check, etc. So there are questions that to be answered, and then they will assess you as either average risk or higher than average risk. So if you are assessed to have average risk for breast cancer, you initiate yearly screening mammography at the age of 40. But if you are assessed with a higher than average risk for breast cancer, you will have yearly screening mammography, and a yearly supplemental imaging. So later on, you will see what the supplemental imaging is. So this screening should be initiated at risk-based age. So what we do is we ask you if you have, example, your mother had breast cancer. We will usually ask the patient, at what age did your mother have breast cancer? So if she says my mother was diagnosed at age 45, we tell the patients to start screening 10 years earlier. So at 35, we tell the patients to have yearly mammography. So that is the risk-based age. And then if your life expectancy is less than 10 years, screening mammography can be discontinued. Okay, so here's like a table. Okay, for women with average risk, tapos non-dense ang breast, annual mammography, and then take note that 3D mammogram is preferred starting at age 40. But if you have increased breast density, you have annual mammography at 40 and supplemental imaging. In our setup in Davao, the supplemental imaging for dense breast is breast ultrasound. Okay. However, if you are higher than average risk, then you have a hereditary susceptibility. So if you are familiar with the BRCA gene, the BRCA gene, no? Or if you're familiar with the case of Angelina Jolie, yan. So yeah, she is a carrier of the BRCA gene. You are at higher than average risk. If you had a history of chest wall radiation at age 10 years old to 30 years old, you are also considered higher than average risk. So if you are part of this group, you have to start MRI, breast MRI at 25 years old, and then annual mammography at 30 years old. And then here we have a lifetime risk model. So there are different models if you will search the internet about risk assessment for breast cancer. So there's a questionnaire and you should answer that, and there's a computation for that. If your lifetime risk is more than 20%, remember for the general population, it's only 13%. But if your predicted lifetime risk is more than 20%, and you have a very strong family history of breast cancer, they recommend annual mammography and supplemental imaging with MRI starting at age 35, or again, when recommended by their physician earlier because of the age risk assessment. So if you see this table, puro mammography. So ang baseline actually is 40 years old. Pero kung meron kayong mga risk factors, it will start at 30 or even younger, 35 or even younger, depending on your the family member who had breast cancer. Okay. For women naman who had prior breast cancer at the age of 50 or above, you have to do annual mammography. But women with prior history of breast cancer at less than age 50, you do mammography and MRI. So these are for women who did not undergo bilateral mastectomy. No, so sometimes you just remove one breast, then to monitor the other breast, this is the recommendation. Okay, so this is a picture of a mammogram. We are very fortunate in Davao. We have already 5 institutions who have the capacity to do digital mammogram, which is the one that is recommended. The 3D or the digital mammogram is already available in Davao City. So the institutions are Davao Doctors Hospital, Broken Shire Memorial Hospital. There's also one in San Pedro Hospital. And in Southern Philippines Medical Center, they also have a digital mammogram there. And the Lanang Premier Hospital, the newly opened. So they have the machine. And then this is what the radiologist will see. And then they have certain characteristics that would tell them that there's a suspicious finding in your mammogram. So just please take note of your questions and then I'll answer them later. Okay, so what is again a mammogram? They are low dose x-rays of the breast that may help define the nature of the lump. Mammograms are recommended for screening to find early cancer. And mammograms, but though mammograms are thought to miss as many as 10 to 15% of breast cancers, there's no other screening method that would be more superior than mammogram. So, because you might ask later on, Doc, bakit nakakamiss naman pala siya ng 10 to 15%? Why do we still do it? Because this is the best screening. No other test can help diagnose or see early stage breast cancer. So again, what I mentioned earlier, the newer type is the digital mammogram, or what we call the breast tomosynthesis machine. So these are the newest mammograms in Davao City. Okay. So I am sure that most of you have heard about the clinical breast exam. So these are examinations that are made by your doctors when you visit them in the clinic, mostly by your OBGYN or your breast surgeon. And we also have the breast self-examination, which you do by yourself, usually in the shower or while lying down. Okay. So before, we always advocate this clinical breast exam and breast self-examination. However, in most of the recommendations already, research has shown that it does not have any benefit of doing the regular breast exams done by the health professionals. Again, that's their clinical breast exam, or by women themselves, your breast self-examination. However, we should not discount that women should be familiar with how their breasts normally look and feel like. So I think this is still important to educate our women to do the breast self-examination. And we always tell our students, our interns and clerks to also still do the clinical breast examination. So whenever you visit your gynecologist or breast surgeons, please don't hesitate to ask them to do the clinical breast examination, because this is still important. So you can compare what you see and feel with what your doctors also see and feel. So this is not part of the recommendations, but we still advocate this one. So to demonstrate, I have some pictures how to perform a self-breast examination. So we usually do it in the shower. Bakit? Kasi usually in the shower, nagsasabon ka, no? You put soap and it makes your fingers slippery. So it will slide lang sa breast. So usually we raise one hand above behind the head, so you can feel for any possible lumps here and also in the armpit. Then after you take your shower, you go to your mirror and you examine your breast. Arms down, arms up, and on your hips. No? So you can see if there are changes in the skin or shape or some skin retraction. So that would tell you that there's something abnormal in your breast. Okay. So also while standing, you can do your circular motion. So sometimes iba-iba ang technique, no? From the nipple, you go circular outside. Others naman from the outside, going to the nipple. Para at the end, you also squeeze your nipple for a possible discharge. And then you can repeat this number 3 while lying down. Because sometimes there are lumps that you feel what you don't feel while standing up, but you can feel them while lying down. So this is another picture. So again, the one I mentioned earlier is the circular pattern. Some would do up and down, and some would do parang circumferential. basta papunta sa middle. So it doesn't have a fixed technique as long as you cover your entire breast. Then again, lying down, you do the same thing. So standing up and lying down. Okay, so that's the breast self-examination. That is also what we do when you go to our clinics for the clinical breast exam. But most of the time, you're already lying down. So it's ganito. First of all, first we ask you to sit and then we examine the breast. Then when you lie down, because we also do our pelvic exam, then we do the examination while you are lying down. Okay. So I inserted some recommendations now that we are still in the COVID-19 era. So PSMO, or the Philippine Society of Medical Oncologists, have a consensus recommendations for the management of breast cancer during COVID. So there was a question there: among asymptomatic patients, how can screening for breast cancer be done during the COVID-19 pandemic? So the answer there in that consensus recommendation is that all screening examinations for breast cancer in asymptomatic patients, again, walang symptoms, including mammography, ultrasound, and MRI, should be temporarily postponed by a few weeks or months or until the post-COVID-19 period. However, since our hospitals now have safety measures in place, if you feel that it's safe for you to go to the hospital, it's still good to continue your screening. But it's not a no-no if you try to discontinue it for now. And hopefully soon, we can overcome the COVID-19 pandemic. Then you can resume all your screening as long as you are asymptomatic. Okay, I think this is my last slide for the breast cancer. So I hope I was able to share the screening recommendations. Next, we have cervical cancer screening. So these are pictures of my actual patients. No? So this is a radical hysterectomy picture. This is a speculum examination. So these are how cervical cancer looks like. And this is the ribbon for cervical cancer. Okay. So what is the cervix? It's the lowest portion of a woman's uterus. So cancer of the cervix occurs when the cells of the cervix change in a way that leads to abnormal growth and invasion of other tissues or organs of the body. So to illustrate, so this is the uterus. The cervix is part of your uterus, so it's the opening. So for women who gave birth vaginally, ito po yung nagdadilate. So that's the cervix. And it's continuous. It opens to your vagina. And this is your endometrium, is the lining of your uterus. And these are your ovaries. So what is cervical cancer? It's the cancer of one of the female organs or your cervix, and it's the easiest female cancer to prevent through screening. So what are the causes? So the main cause of cervical cancer is the genital infection with the human papillomavirus, or more commonly known as your HPV. So this is a virus that is spread by sexual contact. There are many different types of HPV. There are low risk and high risk. And the high risk types can cause the cell changes and cervical cancer. So other risk factors include young age at first coitus. So the first time you had your sexual intercourse at a young age. If you have multiple sexual partners. So what is multiple? We would answer more than one. More than one is already multiple. Multiparity, if you have more than 6 children. But this is usually for vaginal delivery. So hindi naman tayo umaabot ng 6 for cesarean section. Low socioeconomic status because of their poor health-seeking behavior. Okay, cigarette smoking is also a risk factor because the nicotine can cause changes in the cervical epithelium, making it more susceptible to the virus. The presence of other sexually transmitted diseases, STIs na yan siya, sexually transmitted infection. And they say that prolonged oral contraceptive pill use is also a risk factor. But then again, what is central to this is your HPV infection. So even if you have all of this, but you don't have HPV infection, then you will not get cervical cancer. And vice versa, even if you have the HPV, if you are already infected with the human papilloma virus, it still needs other cofactors for it to develop into cancer. So not all women with HPV infection develop cervical cancer, but it is a necessary cause for cervical cancer. So again, it's the type 16 and 18. So this is important because we have already developed several vaccines for this. So we are very lucky that one of the cancers that can be prevented is cervical cancer because we already have a vaccine. Okay. And then again, as mentioned, it can be prevented. And there are several screening tests, which include the gold standard is your pap smear. And right now, what they are promoting is the HPV DNA test. So what is a pap smear? So I hope most of you have already, if not all of you have already undergone your pap smear. So it's an examination of the cervix with the naked eye. We use a speculum, a spatula to get the cells from your cervix. And we put them on a glass slide and we put some reagents and we look at them under the microscope. So we will look for abnormal cells in the pap smear. So here's another picture. This is what we call a cervibroom. So para siyang walis. So this longer tip is inside the endocervical canal and this is in the ectocervix. And then again, this one you can either put it in a liquid medium or on a glass slide. So the pap smear will detect abnormal cells or precancerous cells. And then for women who get regular pap tests, cervical cancer is very rare. It's not because the pap smear is a high pickup rate, but because your doctor can identify if your cervix is abnormal looking. That is why we always encourage women to visit their gynecologist for a pap smear. So when should you schedule a pap smear? It should be before or after a patient's menstrual period. But ideally, it should be after the menstrual period, yung wala na po talagang discharge. And then you should have no sex for 2 days before the test, no douching for 2 days before the test, and you should not use tampons or foams or jellies 2 days before the test. And then for our gynecologist, we do the pap test before we do the internal examination, so as not to remove the cells from the cervix. Okay, so these are the latest guidelines for the prevention and early detection of cervical cancer. So this is based on the guidelines made by the American Cancer Society. Okay, so before, meron screening should be at 18, then meron din screening should start at age 21. But now, through different researches, they already recommended that screening should begin at age 25. This is regardless of the sexual history of the patient. So even if there was still no sexual debut in the United States, they screen women at 25. Then those age 25 to 65 should have primary HPV test every 5 years. So hindi na po pap smear ang kanilang primary recommendation, but the HPV test. because once it's negative, you can get it every 5 years. However, if the primary HPV testing is not available, screening may be done with either a co-test that combines an HPV test with a pap test every 5 years, or pap test alone every 3 years. Okay. Mind you, this is American Cancer Society. And again, as I mentioned earlier, cervical cancer is not in the top 10 of their female cancers. So for now, even if the American Cancer Society came up with these guidelines, our local society has not yet come up with a recommendation. So the recommendation is still annual pap smear for our Filipinas. But if you do a HPV test with pap smear, it can be done every 3 years. Okay. What about those women over 65 years old? So if you had regular screening in the past 10 years, so for example, 66 years old na po, pero simula nung 56 up to 66, meron kang 3 consecutive normal tests, then you can already discontinue screening. As long as wala po kayong pre-malignant condition or the CIN2 or more in the past 25 years. But if you do not have your 3 normal consecutive pap smears, you should still continue screening until you get the 3 normal consecutive tests. Then, what about those women who underwent total hysterectomy, yung sinasabi na tabiso or yan? For those women who underwent hysterectomy, you can stop screening as long as the hysterectomy was not done for cervical cancer or a serious pre-cancer condition. For example, na hysterectomy kayo because of myoma or endometriosis, tapos normal po ang cervix, then you can stop actually screening. There's no need for you to undergo pap smear. And then again, even if you have been vaccinated with your cervical cancer vaccine, you still have to follow the guidelines of cervical cancer screening. So it doesn't mean that if you already finish your vaccination, hindi na po tayo magpapa-screening. We should still continue screening for cervical cancer. So here are some estimated costs for the cervical cancer screening methods. The limitation for the HPV DNA test, although this is already what is recommended, is the cost talaga. It's quite expensive and it is not covered by PhilHealth or HMOs. So they cover only the conventional pap smear. So sometimes you have out of pocket of ranging from 500 to 1,500. And then if you do the co-testing, it will cost more. So co-testing again po is your pap smear and your HPV DNA test. So these are the estimated costs in Davao City po. So what about our HPV vaccines? No, we actually have 3. Unfortunately, Cervarix does not have stocks anymore, yung bivalent vaccine. So what we have is Gardasil. So we have the quadrivalent Gardasil, or meaning they have 4 subtypes, and the nonavalent vaccine, which means that they have the 9 subtypes. So again, it's recommended for the following age group, and the dosing is from 0, 2, and 6 months. Meaning if you have the first dose now, you count 2 months later for the next dose, and then 6 months later for the third dose. As of the present, no booster is recommended. So if you have completed the 3 doses, there's no need for boosters as of the moment. Okay. So it is 100% protective against 70 to 80% of the causes of cervical cancer. So if you have the opportunity to get the vaccine, please get the HPV vaccine. Okay, so wala na tayong Cervarix, but before we have it. What we have now is Gardasil 4 and Gardasil 9. Okay. Again, during the pandemic, the SGOP, or the Society of Gynecologic Oncologists of the Philippines, and the PSCPC, the Philippine Society for Cervical Pathology and Colposcopy, made a consensus statement on cervical cancer screening during the pandemic. So again, routine cervical cancer screening should be postponed until after the pandemic has been completely controlled or the community quarantine has been lifted and provisions for safe clinic consults are in place. But right now, many clinics have been already operational. So if ever you get the chance to visit your OBGYN and it's time for you to get your pap smear, then do so. But this is, they did not make any new recommendation. So this was done late last year, this recommendation. Okay. So that was my last slide for cervical cancer screening. So ACS, the American Cancer Society, has the latest recommendation. Okay, what about endometrial cancer screening? Okay, so first we have to establish on the 2015 Philippine Cancer Facts and Estimates, endometrial cancer is number 9. No, but we catch endometrial cancer at an early stage, and I'll tell you later why. So here are some risk factors for endometrial cancer. We have unopposed estrogen. So if you are not familiar, women have hormones, no? We have progesterone, we have estrogen. So yung estrogen po yung nagpapabata. If nag-menopause na po kayo, wala na pong estrogen. Okay? However, if you still produce estrogen or it is unopposed, sobrang dami po, this can be a factor for endometrial cancer. So usually if you have obesity, you have anovulatory cycles, ito po yung mga PCOS, no? And then if you had breast cancer and you were told to use tamoxifen, yeah. And if you are using estrogen replacement therapy. So these are some causes of your endometrial cancer. How about reproductive factors? Yung nulliparity, yung hindi po nabubuntis, o maaga po nagregla, early menarche, or late menopause. Kasi whenever you get pregnant, nabibreak po yung estrogen nyo. Kasi progesterone is the leading hormone in pregnancy. So lesser ang chances na endometrial cancer if you get pregnant a lot. And there's also a genetic risk factor for endometrial cancer. It's your Lynch type 2 or your hereditary non-polyposis colonic cancer. So this is a famous syndrome for endometrial cancer. Okay. For the guidelines, there is insufficient evidence to recommend screening for endometrial cancer for women at average or somewhat increased risk. So pag tanungin niyo po kami, meron ba screening, doc, if para malaman ko may endometrial cancer? So wala. There's no screening modality for endometrial cancer. What we know is the symptomatology is the key to early diagnosis, meaning if you have abnormal vaginal bleeding, doon po tataas yung aming index of suspicion. What if baka it's due to endometrial cancer? Especially for menopause. So I have to emphasize that women who are menopause, meaning hindi na po nagregla, did not have menstruation for 12 straight months. No? So 12 months, walang bleeding, walang spotting, then you are considered menopause. But after that 12 months, bigla ka nagka-spotting or lumakas po yung bleeding, please consult your gynecologist kasi that is not normal. I always hear my patients tell me na, Doc, wala na ako gipansin akong bleeding. I did not mind my bleeding because they said it's due to menopause. So that's actually misinformation, no? So if you are going to menopause, your bleeding should decrease in amount and should be farther apart. Hindi po lalakas at dadami ang bleeding. So papunta ka ng menopause, dapat po humihina at nawawala at longer ang interval. Pero if lumalakas po, then you just consult your gynecologist. It does not mean it's endometrial cancer right away, but it's better to have it evaluated. Okay. So these are women which endometrial cancer should be included. So again, as mentioned earlier, all patients with postmenopausal bleeding, women with infection inside the uterus, and then when we do our pap smear, we see endometrial cells, nireport ho ng pathologist, endometrial cells in the pap smear. So that's not a normal. And then perimenopausal women with intermenstrual bleed or increased heavy period. So pag perimenopause ka na, yung papunta ka na sa menopause, dapat hindi na siya heavy period. And then premenopausal women with abnormal uterine bleeding, especially those with anovulation, or yung tinatawag po natin na PCOS, yan. We should also consult our gynecologist. And then also for genetic risk, this hereditary non-polyposis colony cancer. So we always ask our patients then if you have relatives with colony cancer, ovarian cancer, and breast cancer. Kasi yan sila po ang mga cancers that are genetically the same. So if you have many relatives that have colony cancer or ovarian cancer, breast cancer, probably you are also at increased risk. So here, what they recommend, because you have the genetic risk, is to have ultrasound and biopsy at age 35. So dito lang po ang merong recommendation for screening. But sa general population, there's no recommended screening for endometrial cancer. Okay, so what is the screening method? We do office endometrial biopsy. So we have this flexible pipelle. We insert it inside the endometrial cavity and get samples. Right now, we also have actually the gold standard is office hysteroscopy, but it's not readily available because of the machine. Or if not office, you do your inpatient hysteroscopy. The limitation of that is the cost. So yung hysteroscopy po, we put a machine, we put an instrument inside your uterus and there's a camera. So you can see what is inside. Kasi pag ganito po na endometrial biopsy, this is a blind procedure, no? We just try to get as much endometrial tissue as possible. But for the hysteroscopy, there's a camera. We can see it clearly. So we can already know where to get the biopsy. Then, when you do the ultrasound, some actually are incidental findings. If you have a thicker endometrium, then we are highly suspecting that there's a problem. The normal endometrium, especially for the menopause, is 4 millimeters. But for women who are still menstruating, the endometrial thickness will depend upon the cycle. No? Kung tapos na ba ang regla, papunta pa lang sa regla, iba-iba po ang measurement niyan. This 4 millimeter cutoff is for postmenopause or for menopausal women. We do not do pap smear to screen for endometrial cancer because this is insensitive. But if may incidental finding na may endometrial cells on your pap smear, then you will be suspicious na baka meron pong underlying endometrial cancer. But this is not a test specifically for endometrial cancer. Okay. Then for the last organ system is the ovarian cancer. So these are different types of ovarian tumors. Okay. So we will go first to the established risk factors for ovarian cancer. So here again, it's like endometrial, you have low parity, or when you use fertility drugs, because you have incessant ovulation. Ano po ibig sabihin ng incessant? You always ovulate if you do not get pregnant. So every month, the woman ovulates, no, para in preparation for pregnancy. But if you do not break it, that's what it means na incessant ovulation. Why is it a possible risk factor for ovarian cancer? Because they say that every time you ovulate, you cause damage to your ovary, to the surface epithelium of your ovary. So when you cause damage, uh, there are genetic factors that would cause probable ovarian cancer. And again, there's the genetic predisposition, your breast ovarian cancer syndrome, your Lynch type 2, and your site-specific ovarian cancer syndrome. So if you also have the BRCA gene for breast cancer, you also have an increased risk for having ovarian cancer. That is why, setting the example of Angelina Jolie, when she had herself tested, she had mastectomy and she also had oophorectomy. She removed her ovaries too. Okay. To date, there's no cost-effective screening program for any ovarian cancer. So actually, the United States, the United Kingdom, they all did studies to see if there is an cost-effective screening program, and they came up with the results last year. No, it's not cost-effective. Why is it not cost-effective? Because I'm sorry. So ideally, for ovarian cancer, it's desirable sana if you can catch it at an early stage, because of course, the earlier the stage, the better the prognosis or the better of chances of cure. But most of the time, we get our ovarian cancers at late stages, stage 3 or stage 4 na. That's the sad reality for ovarian cancer. So an early diagnosis would actually have a dramatic impact on the survival. So what they studied, they did the CA125. I don't know if you are familiar. This is a blood test, no? It's a cancer antigen 125. So they say when it's elevated, there's a probability that you have ovarian cancer. But again, a word of caution, the CA125 is not specific for ovarian cancer. So there's no need actually to do the test if your doctor will not advise you to do so. No, it will just cause unnecessary, undue anxiety for you. So marami pong ibang conditions that can elevate your CA125, not just ovarian cancer. And then they also did a combination, pelvic exam and pelvic ultrasound. So these have been studied, and they're saying the results of the study show that it's not cost effective. So it's a step-by-step actually. So you go to your doctor, wala lang, routine checkup, because most of the time ovarian cancer is asymptomatic. So when the doctor does her pelvic exam and she palpates something abnormal, then she will request for the pelvic ultrasound. And when the ultrasound results are there and there's something suspicious in the ovary, then we request for the CA125. So it's a stepwise. Hindi siya at one time ipagawa na lahat, because it's not cost effective. Okay, so again, a false positive result may cause undue anxiety, unnecessary diagnostic procedures, and unnecessary surgeries. No? So let's just do it. For ovarian cancer, it's usually one step at a time. Okay. Ang good news about ovarian cancer, there are some risk-reducing strategies like early age at first pregnancy, but we of course we do not recommend this to our children. Early menopause. So ito, use of OCPs, baliktad naman sa cervical cancer, because they say that in cervical cancer, the prolonged use of your oral contraceptive pills can cause cervical cancer. But here, if you use pills, it can reduce the risk of your cervical cancer. And then increase parity, mas maraming anak, and breastfeeding actually has a protective effect against breast cancer. And then it's always a combination, pelvic exam, then your transvaginal ultrasound, then your CA125, as mentioned earlier. Okay. If you do the combination, it's costly if it's not warranted. That is why you always wait for the advice of your doctor. And again, it will just give you undue anxiety. But if you are part of the high risk population, no, you have the BRCA mutation, you have family history of breast or ovarian cancer. Usually, if two or more first degree relatives are affected, and you have the Jewish Ashkenazi, you are genetically related to a Jewish Ashkenazi women, no? So these are high risk populations for ovarian cancer, breast and ovarian cancer. So what do we do with these high risk women? So the Society of Gynecologic Oncology recommends genetic risk assessment through education and counseling by a provider with expertise in cancer genetics. No? So there's counseling on what to do, and then you will make your informed decision. So you have to be counseled by a specialist, genetic specialist. Okay. So in summary, it is important to remember that for breast cancer, this is a highly treatable disease, and that screening often enables detection of tumors at the earliest stages when treatment has the best chance of success. So in general, for all cancers, the earlier the stage, the better the prognosis. No, so if we catch them early, they're the best. The best chance for success is also good. So that's for so again for breast cancer, it's mammogram. And then for cervical cancer, pap smear is still the gold standard. However, they are now recommending the HPV DNA test. And among all the cancers I discussed, cervical cancer can be prevented using our vaccines. Okay. For endometrial cancer, there's no screening modality, but symptomatology is the key to early diagnosis. So if you have abnormal vaginal bleeding, as what I mentioned earlier, please do not hesitate to consult your gynecologist. And for ovarian cancer, multimodality approach shows no benefit over routine care. So the routine care is you consult your doctor, she does her physical examination, history taking, and if she advises ultrasound and then subsequently the blood test, the CA125, then do so. But if it's not advised, then there's no benefit for doing these tests if it's not recommended. So I think that's my last slide. Yes. So thank you for your attention.
Thank you very much, Dr. Carol Clavier. Salamat, Nak. That's a very comprehensive lecture, no? But it layman yun siya. Very, very easy to understand. Kuan siya, no? You just placed ano talaga ang pwedeng gawin ng mga kababainhan ng women, no, when it comes to taking care of themselves. Right now, Nak, before you go, before we ask questions, I would just like to share sana to put a face on the cancer na like I would like to share with you the experience of my mom who is a cancer survivor. Don't worry, ako na siya gisulat talag kung siya gisulti. Just to put a face on a you might think na doktor kami, hindi kami dili na mag-cancer among relatives. Mag-cancer gihapon, like my mom just had cancer, and so I'd like to give the floor muna. Nak, before kami mag-question sa iyo, Naka, mag-share lang muna kami ng aming experience sa cancer. O sige, Mami, take it away.
Okay. Good evening.
Ayan.
Sa tanan, everybody. I am Roth Lopez, and 83 years old. I am a survivor of cervical cancer survivor for 18 years now. I was diagnosed with cervical cancer stage 2B.
1B.
2B ko, 2B daw po. 1B.
Sige.
Unsay nahitabo. So, I had a menopausal spotting a day after I arrived from America. Akala ko, stress lang po, but stress lang ko sa pag-travel. I was 64 years old that time, and I was alone in going home with the plane. But when I told my daughter in the Gina na nagdugo ko, a pap smear was done and it proved to be is cervical cancer. Unsay akong gihimo?
Giagian.
Unsay akong giagian? A pap smear was given by Dr. Pangan and a colposcopic guided biopsy ni Dr. Rayel. There was a cervical connotation and a radiotherapy for 24 sessions at Davao Doctors Hospital. The next chemotherapy was given also with cisplatin for 3 sessions. So tapos na to, nag-adto ko sa Manila for a brachytherapy for 3 days sa PGH Davao PGH kay wala man sa center sa Davao Doctors Hospital noong una. So I went to Manila in PGH. I stayed there for my brachytherapy for 3 days sa PGH. Kay wala pa man to. So, after 6 months, nagtabson ako. That means, gikuha na ang tanan sa akong cervical cancer. And so, after 19 years, nagpasalamat ako sa Ginoo, the Almighty, kay sayo daw na-detect ang cancer. Kaya I am still alive and kicking at 83. Ang mensahe ko lang, go for pap smear. An early cancer screening means early detection and early treatment. Daghang salamat kayo.
Thank you very much. That's my mom, experience ni Mommy. So, here we are members of the Amuma. That's why cancer brought us together. Kami tanan, no? So, we are, kanang cancer survivors, cancer warriors pang uban, relatives of patients with cancer, caregivers, tanan. So now we would like to ask, so nak the kanang advice yun nak is to really go for that pap smear. Kasi minsan yung iba, they think that pap smear is expensive and kanang para lang na sa naay kwarta. But actually, it's a life-saving procedure. Especially kanang mga tao na you gave us the risk factors, no? Kasi di ba na, when you do pap smear, you do, parang before you, there is interview muna, no? Importante yun nga moabot ang pasyente sa clinic because that's when you interview the patient, di ba, kanang mga ingana. And so, diha na nimo mapakutanan nak yung early coitus ba, and then after that, we do a lot of kanang isa ka message, isa ka information can lead to a lot of information na kay sayo ka ba nanganak, sayo ba kung pila ba imong partner, nagdugo ka ba, dili ba irregular ba ang menses. And so a simple procedure can actually unearth or open or reveal kung ano talaga ang ating maging potential problems sa mga pasyente. So kanina I was talaga na breast katong breast self-examination na, no? I would just like to kuan na we can do it ourselves. Pero pag meron na tayong nakapa, pa-check up dayon na. Ang OB ba usually no nagahimo man jud ta, or do we
Yes,
really
Doc.
go to a breast surgeon?
Unfortunately, it's not anymore part of the training to diagnose through biopsy ang breast cancer. No? So, it's been part of the breast surgeon. But usually, women kasi, if napansin, although ngayon marami ng babaeng surgeon, but women kasi usually, Filipinas, mahiya talaga magpunta sa lalaki na doktor. So, most of the time, it's the women OB-GYN who pick up the breast masses, or doon pumupunta muna ang mga women na may concern sa breast. Yun ang na-notice ko. I've had many patients din na ang chief complaint lang talaga nila is may breast mass sila nakakapa or sakit ilang tutoy. They go first to the OBGYN. And then if you do your history, physical examination, and your diagnostic examination, then you can actually refer properly for further management to a breast surgeon. We do not do biopsies kasi po.
Okay, thank you very much. And then also, yung sinasabing nila nakba na yung okay lang lagi ng magdugo-dugo, kasi we have a lot of patients now kanang because of the pandemic gani murag daghan ka ay patients karon nga murag nag-irregular menses because di ba ang halos ang tanan na nagko, they gained weight. And so we see a lot of young people, bata pa gani kaayo, dagko na kaayo na, and they have this irregular menses already. And ang tanong, Doc, maka-cancel ba ni Doc nga dugay na kaayo nagaregla or dili ginaregla? Yan yung concern ngayon ng mga women eh. And Doc, unsa ba ni mga nakpabakuani, kinahanglan na bako og unsay further test? Although dili siya cancer nak, but this is something manggod na that will bring the patient to the obstetrician. Yung irregular menses because of weight gain.
Aside from weight gain po, Doc Gina, is yung stress. The stress of the pandemic can cause hormonal changes din sa babae. So, yun. Actually, pag hindi ka nireregla, we have to investigate. Pag grabe naman ang regla or grabe ang pagdudugo, you have to investigate. So, those are the things that, tama ka, Doc Gina, these are the things that would tell the patients to consult your OBGYN. Tapos, magsekunda lang ako, Doc, when the things that you mentioned earlier about the history taking, yun yung magiging chismosa talaga yung OB. Some of the patients siguro sasabihin, bakit tiyatanong man to ni doktora? Part pa ba to? Yes, yung sexual history, kailan ka ba nag-start mag-contact, ilan na ba naging partners mo? And for me, I also ask, yung mga partner mo ba, maraming partners? Yung partner mo ba, babaero? Mga ganon. Because that's really part of the history taking, especially for cervical cancer. So I hope mga patients hindi ma-offend. Hindi ho kami chismosa, part talaga yun ng aming history taking.
O kasi dili man gud siya dinak no na ako'y daghang partner, akong partner daghang partner, na ako'y sakit, di ba siya maing-ana, di ba siya nakabutang sa face natin, so sa face ng mga pasyente. So we really have to ask, and the only way we will know that information, we will be able to extract the information is through question and answer. Well, there are also patients nga dili gid pag-tell. Dili gid mag-reveal, pero siguro na yung art natin how to ask the questions, the proper way to ask them. And it is very vital sa atuang information sa pag-treat ng patient, no. Ah, yung ba na kung ang asawa ba ang asawa ba namatay ng cervical cancer, kung mag-asawa uli yung lalaki, matakdan ba po cervical cancer ang present wife? O isa ba, is that a risk factor also?
Yes, Doc, because we do not know where the virus came from. If it's from the patient who had the cervical cancer or galing mismo sa husband pala. Because, di ba, sa HPV kasi, it's not common for men to have female cancer or anal cancer. Yun kasi ang kinukos ng HPV sa lalaki. So, it's not that common. So, mas common ang cervical cancer. So, it's just a risk factor po. It doesn't necessarily mean na pag nagka-cervical cancer yung asawa niya before, tapos nag-asawa siya ng bago, automatic na magkaka-cervical cancer yung new wife. But it's a risk factor po. Kasi pwedeng carrier ng virus yung husband.
May tanong pa ako na hindi mo sinabi, pero gusto ko lang itanong. Yung partner na mahilig yung may history of contact sa men, having sex with men, will they bring ang women ba na naging partner naman ng mga lalaking yon may risk din sa mga bakla? Di ba
yes,
meron
Doc,
they have boyfriends, not only girlfriends.
Yes. Ano, Doc? Yes, kasi they're still part of multiple sexual partners. So it did not say that yung multiple is multiple na babae. Pwede rin multiple na lalaki. So everyone kasi is a possible carrier of the virus.
Sige.
So it's possible. It's a risk factor po.
Ngayon na COVID ba, are patients who have cancer cleared for the COVID vaccination? Or all know na risk factor ang cancer for para they might have COVID infection serious. So are they cleared for COVID-19 vaccination? Or importante ba lahat sila magkaroon, or may mga population din na hindi din pwede magpa-vaccinate? For all cancer, gynecologic cancers for that matter, no?
For gynecologic cancers, Doc, it will depend on what part of the treatment you are in. So, for example, tapos na ang treatment mo, we sometimes call that no evidence of disease. Yan. We recommend we recommend COVID-19 vaccination. For those undergoing treatment, yung nagki-chemotherapy, nag-radiotherapy, meron po yung scheduling. So we have this in our society na dapat, alam kasi po namin kung kailan yung side effects ng chemotherapy. So yung time na masyadong mababa po yung immune system ng patient, then we do not recommend the giving of the vaccine kasi nakakababa. So there's a certain scheduling. Para lang din po hindi mahirap, those who are really undergoing treatment na chemotherapy, hindi namin ina-allow pa unless it's yung every 3 weeks na chemotherapy. Kasi kung every 3 weeks, there's a period na bumalik na po sa normal dapat ang blood mo, yung status mo, then that's the time. Parang may window of opportunity lang po for the COVID-19 vaccination. But hindi siya anytime pwede ibigay. You have to, for those undergoing treatment, you really have to consult your oncologist kung kailan ka dapat mabigyan ng vaccine. Pero those na tapos na po, okay na, no evidence of disease, yes, by all means, please get the vaccine.
Now, there's a question here from Tita Bell. Sabi niya kasi ignorant daw siya, pero ang tanong niya na, are only women prone to OB/GYN cancer? Meaning, ano man tayo ba mabigay ba natin ang cancer like cervical cancer to matakdan ba ang lalaki? Kasi wala na ano lang kasi, or is it babae lang yun? Or can we give the cancer also to our partners, to men? Can they also be yung term lagi na makatakod ba or ma-transfer ba yung cancer mo sa lalaki? And will he become a risk factor to transfer it lagi? Yun, natanong ko na pala kanina na may partner siya, na may bago siyang partner kay mga matay, yun ang, ay, di ba ka ng pag, when they, they get, yun. Basta yun na, yung parang, basta makatakot ba daw siya sa lalaki? So yun.
So, okay, Doc. Sa pag-understand ko po sa question, yun. Only women are prone to gynecologic cancers kasi ang topic ko po, the ovarian, the endometrial, and the cervical, only women have it. No, kung anatomic-wise, ang babae lang po ang nagkakaroon ng cervical cancer, ng endometrial cancer, and ovarian cancer because the males do not have this. Sa breast, na-mention ko earlier, 1%, kasi may breast pa rin naman ang males, they can also get breast cancer. Regarding naman sa interpretation ni Doc Gina, if makatakod, sa HPV, sa cervical cancer kasi, we know the cause. So it's the virus, the HPV, which is sexually transmitted. So depende kung saan nang galing, we really cannot pinpoint. So kung ang babae, let's just say the female who has the cervical cancer had a partner before. And let's assume that that partner was the one who gave her the virus. And she developed cervical cancer. And she has a new partner now. The possibility po is you can transmit the virus to your new partner. But hindi ho siya magkaka-cervical cancer because he does not have a cervix. The things that can happen to a male is penile cancer, anal cancer, and if you engage in oral sex, pwede rin oropharyngeal cancer. Kasi nakita na rin yun na meron din sa esophagus, dito sa throat, na cause din yan is HPV if you engage in those types of sexual practices. So yun po yung kung makatakod. Ovarian and endometrial, hindi po makatakod kay it's genetic or hormonal or unknown. So hindi natin alam ang cause. So endometrial and ovarian cancers can only happen to women. And if you have an ovarian cancer or if you have an endometrial cancer, you cannot transmit it to anybody else. Kahit sa anak mo, sa asawa mo, hindi mo yan siya ma-spread.
Ang breast, yan may family history. Ang mama ko prone din ba kami?
No, cervical cancer is not genetic.
Okay.
So, meron lang po kayong cancer gene. So, it runs in the family na may cancer gene, but not cervical cancer is not genetic. So, hindi siya. Ang mga genetic, Doc Gina, is ovarian,
breast,
endometrial, colonic, yan, breast cancer.
Yan. Okay. Sige. May tanong si Ate May. Are there agencies or foundations conducting free pap smear? How do you encourage women? Teka, sandali. Ibaba ko sana. Wait ha. Are you encouraging women to, how do you encourage women to have pap smear?
Di ba,
free pap smear, Doc, meron bang for free?
Ate May?
Free pap smear, oo. Sa SPMC, hindi siya free. When you consult the OPD, may bayad po na 75 pesos. Pero kung pwede nyo pong, pero pinapalapit ho kayo ng mga residents sa Lingap, yung mga ganon, para ma-free siya. But unfortunately, SPMC does not have OPD right now because they are a COVID hospital. Foundations, agencies, before, nung wala pang COVID, POGs,
Dogs.
Pogs SMC, we do yearly free pap smears. Different hospitals, I can speak for Davao doctors, we have parang anniversary every time mag-June, nagpapa-pap smear po. Minsan sa St. Jude kami or minsan sa hospital mismo. But that was pre-COVID. So ngayon po kasi yun ang limitation. Tsaka bawal po, baka pagalitan tayo ni Mayor Sara. Kasi ano kasi siya eh, di ba? It's close contact. You cannot do a pap smear na malayo.
Remote.
How do we encourage women to have pap smears? Yun, information dissemination, and the Amuma. Yung mga ganito po na mga fora, very important po talaga to spread. And then SGOP, PSCPC, they also have lay lectures. Ngayon, lalo na in the time na COVID, ang daming webinars. So yun, doon kami nakaka-encourage ng. And then, na-notice ko po, pag mga ganitong topics, yan, nila-live nila on Facebook. Yung hindi masyado medical ang pagka-lecture, para it's free for everyone. So dapat lay lang din ang approach ng lecture.
Yeah, to encourage women to approach it, to encourage women to go for pap smear. Kasi, di ba, when you do the pap smear kasi, istorya-istorya, una, information, makuha mo na kung high risk ang pasyente. And then when you do the pap smear, pag human mag-do pap smear na, di ba, we do IE. So, hindi lang namin nakikita, magunitan sad, we can actually feel for the bukol inside. Kaya lang, ma'am, kung hindi ka mag-pap smear, hindi kasi lagi ko sinasabi, ma'am, hindi kasi nakikita namin sa mata mo kung ano yung cervix mo. That is why, kailangan talaga tingnan ang kondisyon ng cervix. No, kay dili man siya, kung makita pa lang namo ang imong problem sa imong mata, we will not do the pap smear anymore. But since we cannot do it, Mona, we really want you to come in and have us examine you. And so, sometimes I tell also the patients na birthdayhan nyo yung sarili nyo ng pap smear. Because, we spend money on a lot of people sa pag birthday ka, gastos ka. Pero yung pap smear, when you go there, it's your sarili mo yung sinisave mo eh. And di ba yung sa atin na to have a healthy family, dapat healthy good ang mother. So yan. So are there any more questions? Is pap smear needed?
Thank you, Doc.
Napay 2 more questions na lang na-mention kanina, Tita Bel, nasa slide ni Nak, up to what? Yung pala, Nak, di ba sabi mo 25 ka mag-pap smear, mag-start, pero until when, gani, sabi mo pag menopause?
65, Doc.
65.
Pero the caveat there is dapat from age 55 to 65, yung 10-year period na yon, you have 3 normal consecutive pap smears. Then you can stop at 65. Pero
so kung every year ka muna na normal. Tapos after that, pwede na every pila ka years or pag nag 65 ka, kung normal naman lahat,
pwede ka na mag-stop, Doc.
Pero kung
kunwari Doc, nag-pap smear ka ng 55, tapos nakamiss ka ng a few years, nag-pap smear ka ulit at 58, tapos bumalik ka na sa 65 na. Pero itong tatlo na ito, normal lahat, tapos wala kang pre-malignant condition before, you can already stop at 65.
Yeah. Pero di ba si Mami, Nak, she's 84, but her condition kasi is cervical cancer.
So, continuous, tuloy-tuloy yan,
Doc. Until mag-pap smear. Actually, wala namin nag-pap smear.
Ideally, Doc Gina, tuloy-tuloy hanggang kaya ng patient na, kasi it's very difficult, diba? The lithotomy position for older women. Yun talaga ang mahirap. So hanggang kaya po ng pasyente na magpa-pap smear, lalo na if you have a history of cervical cancer, you should do so. Wala po siyang stop. Pero until lang na kaya ng pasyente.
Okay. So here, the last question.
Is pap smear needed for those with no ovaries?
No ovaries.
If you still have your uterus, ibig sabihin may uterus at may cervix ka pa, yes, you still need the pap smear. Kasi the ovaries have no connection to your cervix. Pero if na-hysterectomy ka na, natanggal na mismo yung mattress, pero wala kang history ng cancer, you can stop pap smear. But if you have history of cancer, or meron ka nung pre-malignant, yung CIN2, CIN3, kahit na hysterectomy ka na, kailangan mo pa rin magpa-pap smear.
Again, Lak, gusto ko lang tanong, i-reiterate yung, again yung question. Nak, di ba yung kahit walang sex, do we do pap smear? For single?
Personally, Doc, sige, Doc.
Sige daw, yan daw na ang tanong namin.
Ano ko lang muna to si Che, kasi tinanggal ko na, yes, na radical hysterectomy si Che, oo. Pero since the diagnosis was cervical cancer, even if you already removed the uterus, we still need to do screening. That's just for monitoring, Che, para, kasi sa cancer survivor ka na, and we want to maintain it that way. So that's why we still continue screening. Pero for yung women na natanggalan ng mattress, pero wala namang cancer, walang pre-cancer, you can stop pap smear na. Pwede nang walang pap smear. Ano yung question mo, Doc Gina? Sorry, I forgot.
Single women never had sex. Do you need to do a pap smear?
Sa yung American Cancer Society kasi na guidelines, since it's based sa Western culture, they presume or assume that at 25 you already had sexual intercourse. Diba? Sa Western countries, parang late na nga yun 25 years old na wala kang sex. But in the Philippines, wala pa po kasing guidelines ang local society. Pag meron pong abnormal vaginal bleeding na unexplained by other things, not explained by other things, I do pap smears for virgins o yung walang sexual intercourse. Pero kung asymptomatic, Doc Gina, personally, I do not do it because, diba, frankly, we de-virginize with our speculum. Pero kung meron siyang mga symptoms po, tapos na-exclude ko na yung other reasons for the bleeding, then I do the pap smear even for those who have had no sexual intercourse. Pero that is American Cancer Society kasi siya, Doc, So they are assuming talaga at 25 na kapag sexual intercourse na.
Meron lang din kasi akong i-point na daghan na di ba yung mga yearly pap smears for parang kailangan like teachers, di ba yung mga ganon na parang ginapapap smear nila lahat. So, minsan we see patients na, Dok, wala man akong sex, pero kailangan man namin magsabit ng pap smear. Ano man ang gawin ko? Do we do pap smears pa rin sa kanila na even if they did not have, just because it is a requirement sa kanilang, they have to submit it, parang ganyan?
Yes, Doc. If it's a requirement, we just have to explain to them what will happen if we do the pap smear. Kasi nga, Doc, wala pang recommendation as of now. Even before, Doc, sa Philippines, ang recommendation, there's no provision for those who had no sex yet. Kahit i-review mo yung mga past recommendations ng societies. So wala talaga siyang specific for those women who have had no sex. So
you just do right. You just do it.
Basta i-explain lang po sa patient, Doc, kasi alam mo na, Doc, baka sabihin na meron kang ginawang damage sa kanya since we put speculums. Kahit even the smallest speculum, Doc, can cause hymenal tear, di ba?
Okay. Are there more questions or ano na? if there are no more questions, okay na, Che? President Che, okay na? And so if there are no more questions, ay tepa, mga tanong lang ko, Tita Bell, did we answer your question? Asa na si Tita Bell? Nawala? Okay.
Yes, yes, you did. Thank you, ha, Carol.
Sige, Tita. Sige, salamat, Tita, for the question, ha?
Yeah, okay.
Maraming gustong itanong yung question mo. So it's not dahil ignorante, but because we just want to share na common question siya. Dili siya just kuan. Dili siya impossible question.
Yeah, okay.
The question kay mas nalinawan ang tanan about about gynecologic cancers. And so with that, we'd like to thank Dr. Carol Marjorie Pacholes Flavier. Thank you, Nak, for giving us this, sharing with us your expertise on this topic. We were enlightened, and I'm sure ang imong lecture will be shared kanang ang ana de ito ana de ang information. So daghang salamat, and for allowing us to share you on Facebook, Nak. Thank you very much for giving us your time, your expertise, and your energy. Kapoy kaya mag-lecture, but you've been very gracious and you answered all our questions.
Yes, amen.
Thank you very
You're
much.
welcome. Thank you for the invitation.
Thank you, Nak. I'd
Salamat.
like to give the virtual floor to our MC, Ma'am Joy Enano. Or kay Che.
I think
Agtohan.
any announcement from our president?
Okay.
We need to give
Ma'am
the
Che.
certificate of appreciation first. Please call on our corporate secretary, Ms. Cheryl Odtohan, to read the citation for us.
Thank you. Hello. Good afternoon, good evening, and good morning, wherever you part of the world you are. Okay. Amuma, yes. So let me please read the citation. Amuma Cancer Support Group Foundation Incorporated presents this certificate of appreciation to Dr. Carol Marjorie P. Flavier, FPOGS, FSGOP, for sharing her invaluable knowledge in the Cancer Awareness Webinar series on the topic Current Recommendations for Gynecologic Cancer Screening, given this 9th day of July, year 2021. Signed, Sherilyn Kasuga, President, Amuma Cancer Support Group Foundation, Inc., and Dr. Gina Lopez Batuto, Chair, Education Committee, Amuma Cancer Support Group Foundation, Incorporated.
Ayan, maraming
Thank you.
salamat. Doc
Thank you very much for the
Carol!
opportunity.
Yeah, Doc Carol,
And I
it's so
hope-
nice really to see you again. I mean, I've been, di ba, kay laagan ba ako nimo na pasyente? But yeah, you reminded me of Pap smear kay sa oncologist. Daghan ba ako, Doc, no? So, but my doctors became my friends, and Doc Carol is one of my friends, and she knows that. So anyway, thank you so much, Doc Carol, for your time. And really, it has a refreshing, nag-refresher ako. Parang feeling ko, parang, ay teka, wala na pala akong matres, wala na rin pala akong uterus. So, pero tama, I have to go for pap smear pa rin. So, ladies, you have to take care of your body. Get in touch with your OB. Your OB doctors, they are your friends. Yeah? Do not be ashamed, okay? So, thank you again, Doc. We will send our certificate of appreciation and also a token of our appreciation also. These are Amuma merchandise, and we will send it to your clinic. Thank you again, Doktora.
Thank you.
Ha?
Thank you. Thank you again for the
Thank you.
opportunity.
Thank
And
you.
congratulations.
Thank you.
Salamat po.
Yes, Doc.
Congratulations. Congratulations on your 18th anniversary.
Thank you.
Thank you.
Thank
Thank
you.
you. So, moving on, allow me na lang di po to share my screen. Okay. So, moving on, we will have our photo. Thank you so much, Tito Ding. Okay, stop share. We will have, kasi nandito si Doc Carol. I would like to request everybody to please turn on your camera, and we will have our photo op, virtual photo op. Okay, sige, ang camera natin sa
Joy pa.
Miss Joy, so let me allow me to do gallery view. So these are ilang pages ba ito? We have 2 pages, two ano lang naman. So again, maraming hindi pa po. Please turn on your camera. Hindi po kayo mabibigyan ng certificate of participation. Hala, turn on your camera. Si VP Romy pa naman mag-sign. Sige, ayan, si teacher. Sige, turn on your camera, students. Ayan. Ang iba manggod kay siguro namunas na ba? Okay, sige. Alright. Sige, in 3, 2, 1, smile. Okay, next page. There. Okay.
Thank you very
Maraming
much.
salamat, Doc.
Thank you so much,
Doc
ma'am,
Caro.
Doctor.
Okay, so now allow me to share some announcements since we've given the the certificate of appreciation again to Dr. Carol. Thank you again. So our e-certificates for participation, please fill out the evaluation form to receive this e-certificate, which has been already typed there by VP Romy. No, so you have to fill out that, click that link, and that link will give you the form. It's a Google form. It's a very simple questions lang, and then we will send you the e-certificate of participation. Second, please feel free your evaluation forms. Please feel free po to suggest topics that might interest you, that concerns you, that hopefully, Amuma would be able to help you, no? Education, whether awareness, whether it's about information, whether it's about experience, whether it's about psychological, emotional, and even spiritual, because all of the 5 powerful committees of Amuma is there to help you. We are here to help you, whether you are a member or not a member of Amuma. Okay? So, and then stay tuned for more updates and activities we will have, especially this month, because this month is our anniversary month, our debut, 18th, last July 5. Okay. Next is, again, hopefully that you be one of us, and support the fight, and be with our advocacies, no, about cancer awareness, prevention and control. Allow me to just give an for becoming a member, please contact, naputol siya, Madam Agnes, I'm so sorry, our public relations officer. Okay, that is sandali po. Okay, that is 0999, it's 999-346-3190. Again, it's 0999-346-3190. She is our membership committee in charge. She will take care of you if you want to become a member. And also our email address. And if you would like to support us, you may send in through our BDO account, which it has been posted there. Grace Ado is our corporate treasurer. You may contact her anytime. We can also accept payments on different payment transfer platforms, no, mga payment pera padala. And if you need to contact us, please do. That's my contact number there, 0998-575-4598. You may also email us, and please like our Facebook page. That's Amuma Support. Amuma Support. And you may also check in our YouTube channel, which will be coming out very, very soon. And we will be featuring Amuma stories, featuring those stories that really real life stories, hindi po gawa-gawa. So I really hope that you would support us and join us also para lahat po tayo ay matuto at magkakaroon po tayo ng about the value, about what we're value about our lives, about what we're going through, because cancer is all on forms. Kahit wala po kayong cancer, pwede po kayong maging amuma, ha? So kahit, but if you know somebody with cancer, friend, family member, please, no? Para mas marami tayong malalaman, mas marami po tayong makikilala, at mas marami po tayong makukuhang updates at kung paano natin, kayang-kaya natin labanan emotionally, spiritually, no? Ang cancer na hindi dapat kinatatakutan, because you'll be able to meet cancer warriors. You will be able to meet them, and one of them is Tito Ding right now. He is a brother of our founder, Dr. Margie Domingo, and he is a bone cancer bone cancer survivor, no? Stage 4 po siya, but he is so having a happy soul. So you'll be able to talk to him also. So talk to these kind of people, no, Tito Ding, no? Kasi ang pagiging positive at pagiging happy soul is contagious. Tapos matuto din tayo maging madasalin. Oh, di ba? Thank you so much. All right, so kasi I'll be talking so much na. I'll give the virtual floor to our very beautiful MC, Ate Joy. Go, Teacher Joy. Thank you.
Okay, thank you very much.
Before you start, I would just like to announce the clinic of Dr. Flavier is at Davao Doctors Hospital, ha?
Sa second floor po.
Siya. So kung may mga questions kayo, if you want to visit, go and visit her, second floor po of Davao Doctors Hospital Tower. Thank you very much again na.
Siya doktor ko, Doc Naknak. Doktor ko sana.
Naknak, oo.
Nag-injection sa akin.
Thank you very much, Doc Carol. Thank you very much. It was a very informative talk. Thank you so much, Doc. Okay, the program is about to end. Let's have the closing remarks by the Amuma Vice President, no other than Mr. Romeo Reyes, followed by a closing prayer to be led by Myra Luna Lim.
Okay, good evening again, once again. Okay, ang picture na binigay doon, naka-depict. It depicts what? Tara na, res bakuna sa kasanggaan ng bida. It is the responsibility of the healthcare professional to encourage others to get vaccinated. Do our part to end this pandemic and get back to normal life, but get vaccinated. Vaccines save lives. Moving on to my assigned task of delivering the closing remark, let me take this opportunity to mention Amuma has been giving health education since its foundation in July 2003 to the public through symposia and fora on cancer-related issues. Amuma is committed to its mission of providing holistic care and support through building a healing community. Just mentioned kanina ni President about Amuma. Community for education, counseling, networking, and empowerment, because we care. Hearing and learning from the speaker as well as the audience has educated us and all of us here on cancer awareness, preventive measures, and the recommended gynecologic cancer screening. I am certain that the takeaway from this webinar will further deepen our knowledge about the Big C and increase awareness on cancer secondary prevention through screening. Because of this, Amuma would like to express our appreciation to the speaker, Dr. Carol Marjorie Pasioles Flavier, and our very own Amuma Moderator Education Committee Chair, Dr. Gina Alvarez, for their valuable sharing of their expertise to our webinar on the occasion of the 18th anniversary of the Amuma Cancer Support Group Foundation Incorporated. Our deepest gratitude goes also to all who attended this webinar, whether local or international participants, and help us to make this event a successful one. Another thing, and finally, our deepest thanks also goes to the Amuma Education Committee for running a smooth first webinar series. Thank you, the Education Committee, headed by Dr. Regina. Finally, to all participants, let me remind again everyone to accomplish the evaluation form posted in the chat box, and in exchange for your e-certificate that you will receive in your email. We hope to meet you again virtually in our next webinar series. Sa inyong lahat, maraming salamat po. At this point, Amuma will end the night with an inspirational positive message from Nightbird of AGD 2021. I quote, "You can't wait until life isn't hard anymore before you decide to be happy. I have a 2% chance of survival, but 2% is not 0%. 2% is something, and I wish people knew how amazing it is." Good night, everyone. God bless.
Hello.
Yes, miss.
Can you hear me?
Yes po.
Yes.
Mike, are you around, Mike?
Yes.
Okay.
Yes. So we will have our closing prayer in the name of the Father, and the Son, and the Holy Spirit. Amen. Lord, as we close this webinar on cancer awareness, screening awareness, we thank you for the persons who made this possible. We thank you for the knowledge and wisdom of the speaker and the technical persons, because the topic was so significant and was shared to Amuma members. We also pray for healing of those sick with cancer. Please restore them to full health. Remove all fear and doubt in their hearts. By the power of the Holy Spirit, may you, Lord, be glorified through our lives. Amen. In the name of the Father, and the Son, and the Holy Spirit. Amen.
Okay, that's the end of our program. Thank you very much. Thank you very much, members of the Amuma and all the participants. This is your host, Jocelyn Inano. Once again, good evening.
Evening,
Thank
everyone.
you.
Good evening,
Thank
everyone.
you.
Maraming
Good
salamat.
evening.
Yay!
Thank you.
We did it!
Yay!
Fantastic.